Hey, it's Dr. Amanda from StraightSmile Solutions, and today we're going to be talking about limited orthodontic treatment. I'm doing a series of videos on the differences between the main different types of orthodontic treatment. Do listen to the comprehensive one I just posted. So limited is a little bit different, and my definition of limited, like I said, might be different than someone else's definition of limited. I think I take a pretty conservative definition of limited. But for me, limited is going to be when there's a bigger problem and you're choosing to address part, not all of the problem. Okay, so yeah, you can see it says pretty much the same thing up here, but in a different word. So for example, the vast majority of Smile Direct Club treatment, maybe not all, but the vast majority is probably limited. I'm sure in most cases they're not fixing everything. They might be fixing a diastema or a little bit of lower crowding. Limited could also just be single arch treatment if the upper arch or the other arch needed work too, and the patient's choosing to just focus on one. Okay, limited could be not fixing the bite, fixing the front teeth. Most 6-month smiles treatment would be considered limited, in my opinion, because they're usually not making everything perfect. So your insurance reimbursement is going to be different if you bill the limited, which is D8010, 20, 30, and 40. Okay, so limited in a little kid and all baby teeth, okay, is going to be the D8010. I don't think you're going to be doing that very often. But you could. That could be maybe like some type of, some codes could probably go two different directions, you know? So you just want to keep in mind that if you're using these D8010s, 20s, 30s, and 40s, you're probably using from their orthodontic max, $1,500 a year, $2,000 a year. So if you're using one of these as a limited, later they're not going to be able to do comprehensive because you're going to exhaust it. So the biggest way to piss off a patient is if you don't explain that to them. So just be careful, okay? So obviously limited in adult would be D8040. I don't think I've really ever done limited 10, 20, or 30 because it's just not what I consider standard of care. I'll do it in adult, D8040, because I think that adults have the opportunity to make an educated decision. And if they don't want to do everything, then so be it, as long as I explain the risk, benefits, and alternatives. I mean, obviously, I want to be able to sleep well at night. So no, I'm not going to do like, let's say patient had an edge-to-edge dentition and a large diastema on top. Patient's asking for a limited treatment, upper arch, only just to close the space. But I know, from what I know, if I do that, I'm actually going to make their bite worse. Now that would be limited. But would I choose to do that? No. I want to be able to sleep well at night. So any limited that I'm going to do, I need to know and to be able to document. This is just me. This is keeping yourself out of trouble. That the risks outweigh, the benefits outweigh the risks. So what would be a good limited kind of treatment? Let's say, for example, it could be, let's use the diastema analogy as well. Let's say patient had overjet, not an underbite. Not a negative overjet, but an actual overjet. Front teeth are ahead of the lower teeth. Diastema closure, top teeth only. She doesn't want to fix the overjet because she knows she needs jaw surgery and or maybe premolar extractions, elastics, distalization, something like that. She doesn't want any of that. She's an adult. She's making an educated decision. She just wants her gap closed. No problem. I'll do D8040 on that. But again, if you're doing that, your insurance reimbursement may end up being lower. So keep that in mind to see, you may not be able to get as much funds for that, which, I mean, you really shouldn't in that case. So, all right. So anyways, that is limited. Hope that helps.